herniation is a very common spine problem. So today, let's understand what is a slip disc, why it happens, what are the symptoms, and how can you take care of it. Disc is made up of a outer cloth-like structure called annular fibrosus and the inner jelly-like structure called nucleus pulposus. When nucleus pulposus comes out and start irritating the nerves in the vicinity, this causes pain, tingling, numbness, and sometimes loss of sensation and weakness in the distribution of the nerve. If it's a cervical spine, then symptoms will be in your arms. If the problem is in the lower back, then the symptoms will be in the leg. Now, why the slip disc happens? Majority of the time, the slip disc happens because of chronic wear and tear of the body. Because of the aging process, the disc degenerates, and this degenerated disc is not able to carry the body weight. The people who are overweight, who are into sedentary lifestyle, their disc degenerate faster. The people who are into heavy work, those who do lot of manual labor, in these patients, because of excessive weight on the disc has a tendency to degenerate faster. The disc loses its water content, and that leads to loss of its shock absorbing property. So when the disc comes out, the spinal cord or spinal nerve which are nearby gets irritated and compressed. Though the slip disc to some extent will cause symptoms locally, the primary symptoms of the slip disc are due to nerve irritation. In the beginning, most of the patients feel pain in the distribution of the nerve, which is arm in case of cervical spine and legs in case of lumbar spine. In the later stages, patient might feel tingling, numbness, and in the advanced stages, patient might have loss of sensation or weakness in the arms or legs. Sometimes patients don't feel pain and they directly come with a loss of sensation or weakness. This happens because the pressure on the nerve is more rather than inflammation around the nerve. It usually happens when the disc size is very big and it causes a lot of pressure on the nerve. Now let's talk about the treatment of the slip disc. In more than 80% of the cases, the slip disc heals on its own. And how does that happen? It's not that the slip disc is totally gone, but what happens actually is the inflammation around the nerve gradually subsides. To some extent, disc also shrinks because it is out of its natural place, so it's not getting its nutritional supply, and that's why the disc shrinks over time, and that leads to reduced pressure on the nerve. So reduction in the inflammation over the time and reduction in this mechanical pressure on the nerve will lead to reduction in the patient's symptoms. That's why most of the patients recover without doing any treatment. There are many patients who see a general physician, an orthopedic surgeon, a neurosurgeon, or a spine surgeon, and in the beginning they are all offered what we call as conservative line of treatment. So what we do in that, we give the patient anti-inflammatory medication to reduce the inflammation around the nerve. Most of the time it's routine pain medicines. Sometimes we have to give the steroids also because they are the most potent anti-inflammatory medications. We also give patients pregabalin or gabapentin sort of nerve stabilizing medication, so it reduces the patient's tingling and numbness. Many patients are deficient in B12, especially the vegetarians. So we tend to give them B12 supplementation also. A short course of muscle relaxant in the beginning will reduce your neck pain and muscle pain. In addition to all these treatments, we ask the patient to do hot or cold water fomentation to reduce the local muscle spasm. We give patient brace, either a soft cervical collar or a lumbosacral belt to support the painful area. However, these belts should not be used for a long time, otherwise they will weaken the muscles. Some amount of activity restriction is very important. In case of lower back, we ask the patient not to sit on the floor, lift heavy weight and bend forward. Lifting heavy weight in the bent forward position is the worst thing somebody can do to their lumbar spine. Similarly, in case of neck or cervical spine, we ask the patient not to lift heavy weight, not to look down too much. We would ask them to keep the phone higher up. We will ask them to keep the computer screen higher up so that they don't have to bend down to look at the screen. We also refer the patient for physiotherapy exercises. Now, physiotherapy exercises will primarily make the muscles strong, so the muscles will be able to support the spine better. The physiotherapy will also reduce muscle spasm. Most of the patients, they do get better in about 2 to 3 weeks. And those who don't, we get an MRI done MRI will show us the exact location and the exact nature of the disc prolapse, whether it's mild, moderate, or severe, which particular level is affected, what is the size of the disc. Some patients who are not better, they have an option of taking what we call as epidural steroid injection. In this procedure, we inject very small dose of local anesthetic mixed with steroid next to the nerve which is troubling the patient. Steroids are very potent anti-inflammatory. This will reduce the inflammation around the nerve, and that will lead to significant reduction in the patient's symptom. These injections are not going to last forever, but we hope that when the injection effect is there, the body's natural healing mechanism is also taking care of the disc prolapse. Most of the time, these injections work for about 4 to 6 months. Sometimes they can last for 2 months also, and they can last for 2 years also. Now, if the symptoms come again after the epidural steroid injection, then we have the option of repeating the injection, especially if the patient doesn't show any emergency symptoms like loss of sensation or weakness in the arms or legs. We can repeat the injection 3 to 4 times. If the patient's symptoms are severe or symptoms are recurring again and again after taking multiple injections, and if there is a big disc prolapse, then it's recommended that the patient undergo surgery. Surgeries nowadays are mostly done with endoscopic or microscopic technique. With a very tiny hole, we go in, we remove the culprit disc, we free the nerve. This leads to immediate decrease in the inflammation and pressure on the nerve, and the patient feel very significant symptomatic improvement immediately after the surgery. Many of these surgeries can be done on daycare basis also. Patient comes in the morning, get the surgery done, and by evening they can be discharged. I hope this video was informative to you, and please share this video with somebody who you think is suffering from a slip disc, and it will help them in understanding their problem and deciding which kind of treatment is best suited for them. Thank you.